Good afternoon, everyone. My name is Alma Jane Precious. This is my second video, SEI table. So, self-awareness, know thyself. My SEI skill sets is compassion and gratitude. So, the past months, we are bombarded with COVID patients. So, a dying patient who are in severe pain was moaning one night, and I was giving him pain medicine, but there's no relief. He has multi-organ failures. The family is aware of what is going on. We have a FaceTime day. We FaceTime daily with the family. The patient is on ventilator, rotoprone bed, vasopressors, and other multiple drips. The family could not come since visitors are not allowed in the hospital. The patient expired, but as a nurse, I felt like I'm a failure. I gave 100% in taking care of him, as what my coworkers described me, yet I felt I did not make a difference. Self-awareness is knowing the strength and patting your own back, telling oneself that you did an excellent job. Or the job well done. There is a situation in life that we can't control it or uncontrollable. Blame it to no one. You've done your part. Every day is an opportunity to take care of a sick, and every day I'm privileged to take care of them that others cannot do. The patient died, and I'm holding his hand every single moment that I am with a patient. Either I whisper a prayer or ask permission for them to pray with them. I never take it for granted. That is the chance that I could be there for them when no one can. So the next one is self-management, or organize your life. I pick self-care and resilient. One night I have a bit busy run in ICU. We are taking over of the post-cardiac arrest patient who is holding the thin thread of his life, and he is under our care. It was the most massive and highest patient acuity I had since I became a nurse for 21 years. A rapid transfusion machine was used. There were 32 bags of blood products at that night, aside from the numberless IV fluids. It was a chaos busy night. That night, every single nurse in ICU is dancing like crazy. We are walking like chicken with our heads, you know what I mean. No food, no drink, no bathroom break. We are all emotionally and physically exhausted. In a situation like this, one must have to be resilient in order to bounce back effectively. The following morning after our shift, we all went for a breakfast together with the shift crews that night into the famous cafe near the hospital. After we ate, we did our spa massage. And we have also to take care of ourselves in order for us to take care of others. Although sometimes we are too focused on taking care of other people, but we tend to forget ourselves. But to have self-care, we have to take care of ourselves and to be resilient in order for us to give back to others. If we have more in ourselves, then we could give more to others. The third one is interpersonal communication. It builds relationship. I pick relationship building and teamwork and collaboration. Self-introduction is always necessary when I go to different floors so that they know who I am and why am I doing there. So one night I was doing the rapid response round, and I do rounds, all units in the hospital except for PACU and OR. One night I had an RRT call from the SDU unit. At the same time, I have a code brain calling from the ED department. I responded to the RRT call, and I asked help from my charge nurse in ICU to go down to ED to respond the code brain call. So the respiratory therapists, the doctors, the primary nurses, and the SDU charge nurse were there at the bedside. We're able to help the patient right away, and the patient staying in the unit, we didn't upgrade the patient. The doctor is there and knows what's going on. So in times like this, you can't do it alone. You need other people to collaborate and to help you to do the teamwork. So as nurses, we are flexible in doing teamwork, And if we don't have teamwork in our team, then as what it says, no man is an island. So we are capable of doing great things when we do it together as a team. So that's the relationship building and teamwork and collaboration. The fourth one is the executive function. So make good decisions. I pick critical thinking and problem solving. Every month in our hospital, we have different residents assigned to us. And these are very young doctors. Like, it looks like they're 16 years old, but they're like 20, 21, 22 years old. They're very young doctors. They are really smart, and they have experience, but they have less experience in the clinical side. So one night we keep paging the doctor, but the doctor don't want to come in the bedside. The patient is deteriorating. We page him many times, and the last option is we page the primary doctor. And finally the resident come and at the bedside and responding, and he wasn't happy and he's pissed with what we're doing to him. But we told him about all the labs that came back and all the ABG results, and that the patient is not responding the high flow treatment. This is a COVID patient, and also the BP is crashing, and all other vital signs are all over the place. So when he came at the bedside, all of us, the primary nurse, the ICU charge, and everybody are at the bedside. Outside the room. Of course, this is a COVID patient, and we collaborate and discuss what would be what's the main concern that we have, and also what are the treatments that we're planning to do. So we discuss and we brainstorm each other. And then of course the RT is there trying to adjust the high flow. At the same time, the doctor is discussing that if the high flow would not work, then the next option would be a vent. So we were giving breathing treatments and other stuff to the patient, steroids, making sure that he responds the treatment first before we go to the ventilator. So again, critical thinking, we think what is good for the patient, and also to do some other problem solvings. The last but not the least is social awareness. It says making an impact. I pick empathy and cultural awareness. So empathy is being putting your shoes into other people. It's easier said than done. It is by being sensitive to the needs of others. So we have an experience in ICU that two of our coworkers were diagnosed with cancer. So it was like hard for us because we are working on a night shift, and we have a close family ties in our work family ties in our group. So like if other is sad, everybody's sad. So kind of like we work together as a team. So two of our coworkers were diagnosed with cancer, and each of them had different scheduled surgery dates. So we agreed that in supporting them, we have to give breakfast, and like a moral support and emotional support to them before they undergo any surgery. So we designed special T-shirts for each of them, and we also invited the morning shift to join, whoever wants to join with us, and other family or friends from different units who wanted to join with our prayers and wishes to our coworkers. So that morning, we pretend that we have a birthday breakfast party, but she didn't know that it's for her before she goes surgery on Monday. It was an emotional moment for all of us. I would never forget that. But again, the surgery went well, and both of them recovered fully well, and they're back working with us. So to empathize is just putting your shoes into them. And in our group, in our unit, we are multi-diverse group, because we have nurses from different countries, from China, Philippines, India, Mexico, Puerto Rico, from USA, Canada, UK. So it's all well diverse. So every month we celebrated birthday, and also we celebrate each of the milestone that each of us celebrating. Like one got married, we celebrate for his marriage, and then one deliver birth, we celebrate for the birth of the baby. So again, diversion and unity is always in our group, and I am fortunate for that because I work with a group of people who is willing to support with each other. And I hope you have a great journey in this master's degrees program.